I'm Jean Marie Harris, and I am president of the NAMI Antelope Valley affiliate. Well, my family has a lot of history with mental illness, and what brought me to NAMI originally was my husband had a traumatic brain injury, which exhibited a lot of mental health symptoms that were pretty severe. And so I heard about the family-to-family class and got introduced to NAMI. We also have our oldest daughter that was diagnosed bipolar at age 13, and that was about 8 years prior to my husband having an accident and getting a brain injury. My mother also experienced severe depression when I was a very young child. She was institutionalized when I was 4, and then I also experienced personal depression. I have one sibling, and my brother has a brain injury as well that he received when he was 1 year old from an illness. And so I kind of qualify under all categories. My family has dealt with a long journey, and one of the huge things that NAMI did, in addition to helping me understand mental illness as a brain disorder and being able to cope with my husband's brain injury better, was to eliminate the stigma I had, because I was taught as a child that we do not talk about this. This is a family matter and it stays secret and private. And so it was really difficult for me to acknowledge through my husband's mental illness that I was hiding from my full experience in my family since I was a very young child. And eliminating that stigma and being able to embrace my own mental health challenges as well as understand my other family's issues was life-changing. And so I wanted to give back to NAMI after taking the family-to-family class. I actually brought my 13-year-old granddaughter that we were raising to family-to-family with me, and she was allowed to participate as well, which was amazing. And about halfway through the family-to-family course, I remember so clearly she just looked up and said, "Wow, I thought he was just a jerk." And everything changed, and I wanted to give back because our whole family dynamic changed. My husband loves NAMI for the support that it gave me and other members of the family, and so he is very supportive, and he is doing so well now because we learned how to communicate better and how to understand that it is an illness and it is not his choice when he has some behavior issue, but everything is just great now, and that is because of NAMI. And so I am so thrilled to have a blessing to be able to give back. Yes, it's been difficult for my daughter to accept her diagnosis. We also had a long issue with her becoming addicted to meth, and so substance abuse is so common with a mental illness that we look for some way to feel better. So the acceptance isn't quite there for her, but the rest of us have understood that we do have mental health challenges that we acknowledge, and there is help available. And as part of my journey, I actually became a mental health provider, and I have my own business providing neurofeedback therapy, and that is another huge blessing because I am able to help people have a more full and happy life. The treatment system is so complicated, and many primary care providers don't even know really where to send you. In the area that we live, there are limited resources, but initially with my husband's illness, he was on an insurance program that changed their psychiatric provider every year, and there aren't many to choose from, but every year he would be sent to a new psychiatrist and put on a new treatment program because a different doctor would think different medications were best, and it was really difficult. I have had issue with finding treatment, or even people that wanted to address the symptoms of mental illness, because there is still a lot of stigma even in providers about mental illness and the lack of resources. And so that is another reason why NAMI is so important, because we have to talk about it. We have to get rid of this stigma, the self-stigma, the provider stigma. It's really still a huge issue. It is getting better. But I am an advocate for mental health, and I go to a lot of community events, whether it's Kiwanis Club or Rotary Club or Chambers of Commerce, and I'm allowed to speak openly and share my story. And I have been told on occasion by people after I speak openly about my own journey with myself and my family that I should not speak so openly about it. And now that is part of my story, is that we have to talk about it openly and acknowledge that mental health challenges can affect anyone, anywhere, and no one is exempt. The community issues are huge where I am. The Antelope Valley is northern Los Angeles County and geographically separated from the rest of the county. So many county services do not make it to our region, and we're working very hard to fix that. And my NAMI voice is a big part of that, so that is wonderful. And NAMI having such voice in the nation and the state of California helps me to have that ability. And so we're working on getting more resources available for families and individuals with mental illness, but they're still hard to find. And interestingly, there is more treatment for people that are low income and on Medi-Cal, Medicare, than there is for treatment options available to people with private insurance. Especially parents of children with private insurance are really having a hard time finding treatment for their child. And we have no crisis beds for adolescents, and that is a huge issue as well. When I have parents that are sitting in the emergency room with their child in crisis for 3 days looking for a bed, that is not helping the crisis situation at all. And often they are discharged without even a bed being found. And if they do find a bed, it's usually in another county. I'm so passionate about mental health and supporting families that are dealing with mental health crisis and being able to change lives. But I have to have a balance between my volunteer work and my job and my family and myself. And so I am very focused on attaining that balance and not getting burned out in any one area, because I'm important too.